7:52 at WBAP. New Year's Eve can be very difficult and tempting for holiday recovering alcoholics and for people who drink and who can no longer handle it properly. WBAP's Eric Bushman spoke with Dr. Mikhail, who is an addiction psychiatrist at Dallas-based Enterhealth.
In terms of prevention, what is your advice to either a recovering alcoholic or someone who may be on the fence of whether or not they can handle it or can't around this time of year, besides the advice of don't drink? Is there other advice that you can give?
Well, I do think that if you are on the fence of considering that you have a problem with alcohol, you should approach people that you trust, either family or friends, that are not necessarily heavy drinkers, and say, look, I'm wondering whether this is a problem. In the next few days, until I get some professional help, I really need for you to help me, keep tabs on what I'm drinking, when I'm drinking, what I do when I'm drinking, and encourage me or remind me that I need to curb the use of alcohol. It's frequently the case that, no matter how many reminders or messages that individual gets about you're already drinking too much, by that time the brain is already operating on autopilot and they don't hear it. But then the request would be, please make sure that I physically am removed from the location where I am drinking too much, and that you make sure that I'm safe and you make sure that I'm not doing something that is going to cause some irreparable damage either to my family, to my job, to my relationships. If somebody is already, an alcoholic that recognizes he has this illness and this addiction that is out of control, then hopefully they will already have talked to somebody in a professional capacity and said, I'm at risk. I know this is a difficult time of the year for me. I know that this is one of the times of the year when I really drink very heavily. What can I do? And then there are medications that can be used to either curb the cravings,